Welcome to our channel Hashmi Clinics.
Welcome, colleagues. In this masterclass, we're going to take a really deep dive into Aletris Farinosa, also known as Stargrass. Now, this is an absolutely crucial remedy for a state of profound debility, and our goal today is to really get a grip on its core essence so you can prescribe it with precision and confidence in your clinic. So let's start with the absolute keynote of Aletris. This is the one phrase that should immediately, and I mean immediately, bring this remedy to your mind. The patient is tired all the time. This isn't just everyday fatigue. It's a profound, unyielding weariness that forms the absolute center of the entire remedy picture. So where does this incredible fatigue come from? What's the pathological soil that it grows in? Well, it all springs from a state of profound debility and what we call atony. Let's break down exactly what that looks like. Now, we're not just talking about normal tiredness here. This is a deep, constitutional lack of tone, a paretic condition where the muscles are just lax and weak. It's almost as if the body's internal elastic has completely given out. You'll often see this in anemic or chlorotic women, and it's frequently triggered by a long, drawn-out illness or the loss of vital fluids. This state of atony, this is the foundation for everything else that follows. And here you can see the whole picture really starting to come together. The constitution, anemic and debilitated. The keynote, of course, is that constant, crushing fatigue. This is always accompanied by a sensation of heaviness, a physical weight, and it all manifests in some key areas. Uterine weakness, which causes that tendency to abortion, digestive atony with a total loss of appetite, and this peculiar frothy saliva. These right here are the pillars of Aletris. So, as you can imagine, this profound physical drain has a direct, and I mean direct, impact on the mind. The mental state is really just a clear reflection of the body's complete and utter exhaustion. The crucial point to grasp here is that this is not an anxious mind, it's not a restless mind. It's simply too tired to function. We see what you could call mental prostration, or what the old masters called brain fag. The patient can't concentrate, not because they're distracted, but because they have a complete lack of mental energy. Just the act of thinking is an exhausting effort. Okay, this brings us to the grand central arena for Aletris, the female reproductive system. That atony we've been talking about finds its most potent, its most characteristic expression right here. This is a first-grade cardinal indication. Honestly, when you have a patient with a history of recurrent miscarriage, especially from uterine inertia, where the womb simply lacks the tone to hold a pregnancy, Aletris has to be at the very top of your list. The weakness is the cause. It's as simple as that. This lack of tone, this atony, translates into a very distinct physical sensation, a constant weight. It's a dragging or bearing down in the pelvis, almost as if the uterus itself is physically pulling everything down. And a key confirming symptom you need to look for is a corresponding pain in the right inguinal median. That's a great little detail. Now look at the menstrual picture. At first glance, it might seem contradictory, right? The flow can be too early and profuse, or it can be late and scanty. But the underlying theme is perfectly consistent. Whether she's hemorrhaging or the flow is suppressed, the root cause is uterine atony. The pains are severe, they're labor-like, and the blood is often dark and clotted. Oh, and that peculiar little cough that shows up just before the menses, that's a fantastic little keynote to keep in your back pocket. You see, even the discharges tell the story of debility. The leukorrhea is a passive discharge that comes purely from weakness. It's typically white and stringy, and it's just one more sign that the entire system is completely drained and lacks any kind of tonicity. Now, this atony isn't just confined to the pelvis. Oh no, it powerfully impacts the entire digestive tract, which really shows you just how systemic this weakness is.
The parallel here is just striking, isn't it? The stomach is too weak to digest, which leads to this loss of appetite and distress from even the smallest amount of food. Then, at the other end, the rectum is too weak to expel. It's a paralytic condition, leading to constipation with these large, hard stools. It's the exact same pathology, atony, manifesting all the way through the GI tract.
All right, so beyond the female and digestive spheres, there are a few other really characteristic symptoms that will help you lock in your prescription. Let's cover those now. What's so crucial here is the repetition of these core sensations. That feeling of weight in the uterus, it's mirrored by a sensation of weight in the back of the head, in the occiput. That pelvic floor relaxation, Well, it's mirrored by urinary incontinence on exertion. And the backache, it's a pain of pure structural weakness, a feeling as if the back will literally break. And as always, the modalities are absolutely essential. They give us that final confirmation and really allow us to fine-tune our understanding of this remedy's unique energetic pattern. The aggravations are exactly what we'd expect, aren't they? Anything that further depletes the patient, like loss of fluids or a long illness, makes them worse. But have a look at the ameliorations. The relief of nausea from coffee is a classic. And for colic, the relief from passing flatus and especially from bending backward is a highly characteristic modality. Now, why bending backward? Well, it mechanically reduces the drag from those atonic abdominal organs. It provides temporary relief, and it's a great way to differentiate it from many other colic remedies. Okay, let's put Aletris into context. We'll do this by comparing it with its closest relatives. This is where we really sharpen our prescribing skills and avoid those common mistakes. The real key here is to identify the center of gravity for the patient's pathology. So while China's weakness comes from acute fluid loss, and Halonia's has more of that uterine consciousness and depression, in Aletris, the entire systemic exhaustion, that feeling of being tired all the time, it all originates from the weak atonic uterus. The engine of the problem is in the pelvis. So, when should you be thinking of Aletris, even when the picture isn't a textbook classic? I want you to consider it in modern diagnoses like chronic fatigue syndrome, fibromyalgia, or nervous dyspepsia, especially in women. Think about it when you can trace the origin of that exhaustion back to this deep-seated uterine debility, anemia, and a history of menstrual or obstetric problems. So if you take just one thing away from our time together today, please let it be this. The profound body and mind fatigue of the Aletris patient is a direct consequence of a weak, atonic uterus. The engine of the entire problem is located in the pelvis. If you can address this root cause, you have a chance to restore the entire system. Thank you.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.